So now it's time to tape the cervical paraspinals, aka the neck. You have lumbar paraspinals, so low back paraspinals, thoracic paraspinals, which are mid back paraspinals, and cervical paraspinals, which are the paraspinals in your neck. Paraspinals are vertically oriented muscles running alongside either side of your spinous processes. So your spinous processes are the pokey parts that stick out of your spine when you feel your back. These cervical paraspinals can become achy or strained if we have a forward head position. So for people who maybe sit a lot, sit at a desk a lot, drive a lot, type a lot, sit on a couch especially a lot, are on their phones a lot, or playing video games, very often as you sit comfortably, quote unquote, or slouch, your head becomes in a more forward position relative to your spine. And what that does is it no longer allows the spine to hold your head up. It's more the muscles having to hold that head up. And so they can become very tired and achy. The other time that I use this taping a lot is for whiplash injuries. When we have whiplash, it can strain these exact muscles. It can lead to other things. But on that note, I do want to say, when we're taping, all of these tapes are assuming that serious injury has been ruled out. So again, if you're not a medical professional and something traumatic has happened to somebody, because you always want to consider the mechanism of injury, how did this happen? You want, if it's traumatic, you want to make sure that that person has been medically evaluated and serious injury has been ruled out before we start taping. Okay, so to tape the individual, let's watch the next video. So let's watch the taping. So I have a Y strip for this. First thing I do is I rip the anchor about a 1-inch piece at the bottom. Then what I like to do is rip the middle part as well so that the Y parts are kind of free. I peel the paper from my anchor. I anchor it below the 7th cervical spinous process. So this is the most pointy part on the back of the neck. I give it some friction to help it stick. I rip the middle part. I add a little bit of tension as I stick the middle part on. Now I peel the paper back from one of the Y strips. I have my patient drop the head down to stretch out the muscle. No anchor at that very, very top part. Watch again. Peel the paper, add some tension, and then no tension at the top. Good. Let's watch it again, just so we can become really familiar with this. Okay, once again, we've got our Y strip. You rip your 1-inch anchor. You rip the middle section right below the little Y strips. You peel off the paper for the anchor, trying not to touch it. Anchor it below the 7th cervical spinous process. So this is around T2 for him. Give it some friction, help it stick. Peel off the middle part. Give it some friction, help it stick. That one had a little bit of tension in it. Peel off the paper for one side. Drop the head down, stretch the muscle out. Pull that tape up, stick it on. No tension at the very top. Head still down, peel the paper, stick it on with tension, no tension at the top.